the outside part. We're going to open up in a fairly systematic way. This is not a real fine-tuned dissection like you might do if you're in vet school, but you're going to start off with making a ventral midline incision through the chest area. Around the neck, there's already going to be some skin missing because that's where they went and found the carotid arteries and the jugular veins and injected them with the blue and the red latex. But you're going to make your incision and start peeling back, and I've already skinned mine back, and you will notice the loose areolar connective tissue. That's pretty easy to take care of with your scalpel. You peel that back. And at this point, I want you to find the diaphragm. I've never yet come up with a foolproof way just to find the diaphragm. First time, no problem. What I generally wind up doing myself is making a little bit of slit about where I think the diaphragm is, making a big enough hole to put my finger in, sticking my finger in, and palpating the diaphragm from the abdominal side. That way I know about where the diaphragm is, and then I'm able to make a cut transversely like so. And with care, you don't want to go too deep, too fast. There are going to be some ribs in the way. We do have rib scissors to cut bone with. So you're making a cut like that, once you know where the diaphragm is. And then you're going to take your scalpel and make some cuts on the side. Try to make them as close to the dorsal as you can. If you just do the very top, you don't have much of a hole to go down into. Try to go as far down the side as you can. You start that with the scalpel, and then you'll have to do the individual ribs with the shears, with the rib shears. Something else I want you to not do, don't cut down the midline, and don't open at the sternum. That's just, you can, it would work, but I told you not to, so don't do it, okay? I'm like your mother, just do as I say. But anyway, once you have done that, and you'll notice as you get more cranial with the ribs, they get harder to cut. The very first pair of ribs, what's the name for that? Thoracic inlet. They're pretty narrow, they're pretty close to each other, and they can be hard to cut, so you'll just palpate and feel. The goal is to be able to lift the chest off like that. And here we go. And I do want you to note that we do have inside thoracic wall, we have the inside the diaphragm, inside thoracic wall. If you peel just a little bit, you see how we got this real fine little membrane that I'm peeling up a little bit. Real fine membrane, that's the parietal pleura. Parietal meaning on the wall, pleura. We have visceral pleura on the organs themselves. And coming down here, you can see the heart, you can see the lungs, you can see the diaphragm, all that's kind of fun. You want to start working your way up. You're going to slit the skin all the way to the chin, and you're going to want to reflect that skin. And you're going to want to find the mandibles, the jawbones. They're making a little V shape there. You want to cut inside that V shape and loosen up that muscle, and you want to be able to make a hole through there. And you want to be able to do this. If I can do it, you want to be able to pull the part tongue out, you want to be able to do that. This is called the pluck. Because I plucked it out, I guess. I don't know. Y'all are no fun at all. I get sometimes when I do this.
We gotta pluck it.
You gotta pluck it out of there. But it doesn't come out quite that easy. You gotta make it come out. You gotta kind of work at it. When you are in this area, you cut it. You pulled, made a hole. You're starting to pull the tongue down, and you're having to cut some of the tissue in this area. Look real careful and see if you can find tonsils. I've got a bit of one right there, which doesn't show up terribly well. We're looking at, these are the size of large gloves that don't fit real well either. I lost where to go. I lost it, oh my goodness. But it's sort of, you can sort of see the little crypt there, and it's sticking out there a little bit. So you're looking carefully to see if you can identify the tonsils on the way through. You will have to cut hyoid bones. Those of you that are close enough can actually see the hyoid bones that I've cut. There's one right there, and there's one right there. And do be careful. When you're starting to dissect this out, you can, there's a couple of muscles here, we don't learn all the muscle names. Go through them very, very carefully. Don't just strip the trachea. One of the things that you're looking for as you gently and carefully remove some of this tissue from around the trachea, you're working your way up. You see the rings of the trachea, correct? Mm-hmm. You can tell at this point that you're getting to the larynx. You can feel it. But just before you get to the larynx, you're looking for thyroid glands. And we have not discussed that in class because that comes later on, but this is where we're going to find them. There's one of the thyroid glands, there's one of the thyroid glands. We know them mainly by their location. They are very easy to strip away if you're not paying attention. You're just taking tissue away willy-nilly. So look, have Christopher come help you if it's not apparent.
Can you point them out again?
Okay, there's one right there,
Oh, okay.
and there's one right there, and they look like basically not much, don't they?
Are they just a little...
A little pink looking.
Oval
Just,
shape?
yes,
Yeah.
they're between my thumb
Oh,
there,
okay.
between my thumb there.
Oh my, looks like a worm.
Yeah, a little wormy thing. Between my thumb there, thumbs between my thumbs there, that little pink thing. Sometimes you can see a little patch of different colored tissue that's parathyroid glands. It's not popping up real good on this one. So be careful and try not to strip all that out. After you have the pharyngeal area loosened up, you probably can go in with your fingers and kind of finger dissect down to about this point. And then you sort of look carefully at what you're cutting. You may or may not be able to see the thoracic duct on the left side. We'll look or try to get a look at that. What you can see, if you're getting close up and paying attention, you can see a little line running there, a little line running there. That's the sympathetic chain. Remember that from the nervous system. By the time you're all the way down here to the diaphragm and you're trying to remove this entirely, there's a couple of structures you've got to cut. You've got to cut the caudal vena cava, the esophagus, and the aorta. And there are various depths there. Here is the esophagus. Here is the caudal vena cava. There's the little aorta. Doesn't look like much. This one didn't fill up very well with latex. But it's not as big as you think. The chest cavity is not as big as you think it's going to be. It's kind of fun. Once you've got this out, you can, I have not taken the what is this thing called? The sac around the pericardial sac. You can start peeling that back. You can start looking for cranial vena cava. Already found the caudal vena cava right there. And you can find the aorta or try to find the aorta, how it's coming down. When you're coming back up here, look at the tongue. Notice that the cat tongue's got the little barbs on it. Everybody's been licked by a cat, right? Isn't that fun?
Yeah, some are worse than
Short
others.
term, there's going to be some soft palate tissue. I've not removed all of mine. When I cut, I like to cut down real deep and make sure I've still got some soft palate. You're looking at the actual cat. You can see the nasal passages. They've sort of come together into one at this point. So you'll get a look at that. So we've got our soft tissue there, our soft palate. And somebody hands, there's some scissors in here. I try not to cut up everything for the other group. So I'm cutting the soft palate so we're getting a better look here into the pharyngeal area. Do you notice something real obvious that we've talked about?
Yes,
Epiglottis. It even looks a little bit yellowish, didn't what I tell you? A little bit of elastic, that yellow elastic connective tissue when you're making that little bit of a yellowish look. So you can see it, and it's a triangular shape, the little tips pointing straight at you when you're looking down your throat. And then you've got the opening right there. And what's the name of that opening into the larynx? If this is the epiglottis, what's the opening?
The glottis.
The glottis. And we also have the esophagus up here, and I've opened it up. I put my instrument down in there and I opened up part of the esophagus. And down here I haven't opened it up anymore, but that's still esophagus. Up here we started opening the trachea also, and I do not have that opened up all the way, but you all can do that. You can see the rings. That's interesting. And I told you something interesting about the caudal esophagus of the cat, didn't I? Didn't I say something about that? And I'll open up a little bit more. Notice the esophagus back here. Big tubular structure. Carefully. Open that up again. See that herringbone pattern there? Just like we say.
Oh, wow.
That's kind of... Get a good picture? So you can see all of that yourself.
What purpose does that serve in a cat?
I have not a clue. I don't have a clue.
But it's only in cats.
Cats that I know of. Dogs don't have it. People don't have it that I know of. So that looks easy, right? It took me 1 hour and a half or 2 hours to get this far done today. And it was not nearly so time consuming. You put him back together so he looks happy. Okay. And portal. And you can open up more things. You can get into the heart if you want to. I like to keep them kind of covered up so it doesn't dry up and be nasty. And you're going to keep all these pieces in flaps so you can cover it back up so it's not going to deteriorate so much. By the way, when you're doing around the arms, you can make little cuts in the skin like I've made there, and make little flaps around the arm, and make them cut what you need to make them lie flat. There's nice loose areolar connective tissue in there. Isn't that beautiful? Okay, y'all can go do yourselves.